Okay, good evening, everyone. This is Mick Stewart. Many of you have been asking for some help with pharmacology and drug calculations. So that's what we're going to work on right now. I've got this video that we're going to go through is for IV infusions. I'll have a separate video for doing IV push drug calculations. So if you've watched the other video already, you've already gone through some of this information. If not, this is a good review regardless. So the first thing you're going to need to know when you're setting up your drug calculations, what your doctor's orders are. You're going to get those doctor's orders either from your standing orders from your protocols, or you may contact Dr. Hartman directly and get medical control orders over the radio, over the phone. You may contact some other medical direction physician and get your orders from that individual. I am going to cut my camera off so you can see this full thing here when we're talking about concentration. So the next thing we need to find out is what our drug concentration is. You want to go by the concentration on the container, the vial, the bag, the pre-fill, whatever it is that you're holding in your hand. Don't go by the concentration that you know, oh, I've had this before, I know what this is, because your supply officer might have ordered a different drug from a different supplier or the same drug from a different supplier, and it's got a different concentration. So I want you to actually look at the drug in hand. That's where you're going to get your concentration information from. When we're looking at this lidocaine example here, in this entire bag, we've got 2 grams of lidocaine. It's dissolved in 500 milliliters of solution. Now, if I take a syringe and I draw 1 milliliter of drug of solution out of this bag, that 1 ml is going to have 4 milligrams of drug in it. I can use, or you can use, either concentration you want. You can use the full 2 grams in 500 mLs, or you can use the 4 milligrams per milliliter concentration in your calculation. Either one you use is going to give you the correct answer. My recommendation for real world is use the one with the smaller numbers. In this case, use the 4 milligrams per milliliter. Your math is going to be a lot easier than having to deal with 2 grams in 500 ml or 2,000 micrograms in 500 mLs. I'm going to be showing you the way to do it. Generally, we're going to be using the full dose, the full amount that's in the container as we're doing these examples. But again, you can use either way. Your concentration is going to be generally expressed as milligrams per milliliter or micrograms per milliliter. Now, I don't think I talked about on the doctor's orders that's going to be expressed usually in milliliters per hour, milligrams per minute. It might be milligrams per kilo per minute or micrograms per kilo per minute. Notice that these variations here are weight-based, so it's so much drug per the patient's amount of weight, and we'll talk about that more in just a moment. You're going to need to know what your drip set is. Again, this is an infusion, so this is taking a drug that's mixed, either pre-mixed or you mixed it in a bag of solution, and you're going to run it through a drip set through IV tubing into your patient. If you're using a mixed drug like lidocaine, epinephrine, Levophed, nitroglycerin, anything like that, dopamine, that's going to go through a 60 drop per milliliter drip set or a micro drip set. If you're infusing an isotonic crystalloid, something like normal saline, lactator ringers, some type of volume expander, you're probably going to be using a 10 drop per milliliter drip set. Finally, we need to know if it is a weight-based drug like our milligrams per kilo per minute or a micrograms per kilo per minute. We're going to need to know what our patient's weight is in kilograms. Now, you ask someone in the United States what their patient's weight is, they're not going to tell you, oh, I weigh 100 kilos. They're going to tell you, I weigh 220 pounds. So you're going to have to do that conversion. Now, I'm going to switch over to my whiteboard. And I apologize, I'm going to be doing quite a bit of bouncing back and forth here between the presentation and the whiteboard, so just bear with me. So let me just give you a couple of examples. If you have a patient who weighs 110 pounds, and you need to know how many kilograms that is, you're going to divide the patient's weight in pounds by 2.2. I'm just going to add some extra zeros in there. I've got my decimal point right there. Outside of the box, I move my decimal point 1 spot. Inside the box, I move my decimal point over 1 spot. 22 does not go into 11, but we know that 22 is going to go into 110. Let's call it 5 times. 5 times 22 is going to be 110. 110 minus 110 is 0. The next 0 comes down. 0 will go into 0 times. So our 110-pound patient, pretty small patient, is going to weigh 50 kilograms. In case you missed that, I'm going to do one more for you. Let's say we've got a patient who weighs 132 pounds. Again, still pretty small patient. 132 pounds. We want to know how many kilograms that is. Again, we're going to divide 2.2 into 132 pounds. Okay. Move the decimal point, move the decimal point. 22 will go into 132. Let's try 6. 6 times 2 is 12. Carry 1. 6 times 2 is 12. That's 13. 132 minus 132 is 0. The next 0 comes down. 22 will go into 0 0 times. So our 132-pound patient is going to weigh 60 kilograms. Again, you're going to want to do this calculation on the front end generally when you're setting up any kind of weight-based drug. All right. So let's take a look at the first problem to solve. So we're going to be doing epinephrine to start with. Now, epinephrine may come pre-mixed, or you may be mixing it yourself. Epinephrine is generally mixed as 1 milligram in 500 mLs. Now, you can use the ampule with 1 milligram per milliliter, or you can use the pre-fill that is 1 milligram in 10 mLs. A milligram of epinephrine is a milligram of epinephrine. It's whichever choice you want to make as to what you use, or it's whatever you've got available. Now, remember, before you infuse or mix this drug into the bag, if I'm going to use the 1 milliliter concentration, I need to draw a milliliter out of the bag. If I'm going to use the 10 ml concentration, I need to draw 10 mLs out of this bag before I inject my medication into it, mix it up. Also remember, on that bag, you want to put a piece of tape on there. You want to mark what the drug is, epinephrine. It's 1 milligram mixed in 500 mLs. That's your concentration you want to put on there. Put the date on there as well as your name, in case anybody's got any questions. So we're going to switch back over to the whiteboard. I can figure out where my mouse went. Here it is. And we're going to go back over to the whiteboard to set this equation up for you. All right, so the first thing we've got is our 2 micrograms per minute. I'm going to write 2 micrograms per minute. Now, this is not a weight-based drug. It doesn't say 2 micrograms per kilo per minute. It's just a straight 2 micrograms per minute. I've got my drip set, 60 drops per milliliter. Now, very important, make sure you write mLs here, because the final answer we're aiming for is going to be so many drops per minute. Don't confuse your drip set with what your infusion rate is. Now, stop writing and just pay attention. Don't write this down because I'm going to make you erase it. Next thing we need to put in is our concentration. Now, we normally express this as I've got 1 milligram in 500 milliliters. That's just common vernacular, common way we say it. I've got to mark out all of my units that match up. The problem is the units have to be opposite. I need milliliters on the top, milliliters on the bottom. In this case, I've got milliliters on both the bottom, so I can't work with that. So what I'm going to have to do is flip my concentration. The reason I can flip my concentration, I want you to think about it this way. Let me erase this bit of information off first. Think about, I've got a container, I've got a bag, I've got a whatever, pre-fill whatever. I've got this container, I've got 1 milligram that is mixed in 500 mLs of solution. Or I've got 500 milliliters of solution that's got 1 milligram of drug dissolved in it. I'm saying the exact same thing, so I can flip my concentration however I need to make this work out. So the way I'm going to work this in my equation is I'm going to write it, express it as 500 milliliters over 1 milligram. Now, I've used all the information I've got. I've got a doctor's orders, I've got a drip set, I've got a drug concentration. Now I want to mark out units. Don't worry about the numbers right now, just look at the units. So I've got milliliters on the top, milliliters on the bottom. I did my flip so I can make that work. Now I'm left on the left side of my equation, right? I've got micrograms and minutes, I've got drops and milligrams. That's a problem. I need all that to go away, so the only thing left is my drops per minute, just like I've got on the right side of the equation. So I remember that the relationship between milligrams and micrograms is it takes 1,000 micrograms to make 1 milligram. So I'm just going to mark that milligram out and I'm going to replace it with 1,000 micrograms. Now I can mark micrograms off the top, micrograms off the bottom. I'm left with drops over minutes on the left side of the equation, drops over minute on the right side of the equation. So now I know my equation is set up properly. Now I can do the math. Some of you might remember the little trick of marking out zeros. I've got 1 0 on the top, 1 on the bottom, 1 on the top, 1 on the bottom, 1 on the top, 1 on the bottom. So now instead of multiplying 2 times 60 times 500 divided by 1,000, this is 2 times 6, which is 12, times 5 is 60 divided by 1. And we know that 60 divided by 1 is 60. So the answer to my equation or my question is 2 micrograms per minute using a 60 drop per milliliter drip set with a concentration of 500 mLs with a milligram in it of epinephrine. I'm going to deliver 60 drops per minute. Now, one more thing to think about. I've got 60 seconds in a minute, and I've got to give 60 drops per minute. So I'm going to administer 1 drop every second to my patient. I should just be counting 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000. And every second that I count, there should be a drop coming through the drip chamber of my IV infusion set. Okay, so we're going to erase all that and go back over to our presentation to look at the next problem. Okay, the next thing we've got is a nitroglycerin infusion. Nitroglycerin infusion. And I've got a typo here, I'm noticing it. This should be, I intended this to be 20 micrograms per minute. So let me just make that change there, I apologize. You will have this available to you and downloaded. I'll make sure that your downloaded version is correct. So I want to infuse nitroglycerin 20 micrograms per minute to a patient with myocardial ischemia. The drug concentration is 50 milligrams and 250 mLs. So I can see right here, a little bit difficult to see, but I've got my drug concentration right here, 50 milligrams and 250 mLs. I could use the 200 micrograms per milliliter concentration if I chose to. Smaller numbers, easier to work with, but we're going to go with the equation just as it's given to us. So again, I apologize for the typo there. We're going to go with an infusion of 20 micrograms per minute. And it didn't actually say it in the equation, but again, this is a drug. It's a mixed drug that we're going to infuse in our patients. So we're going to need that 60 drop per milliliter, not per minute, per milliliter drip infusion set. And remember, we've got that concentration that I've got to flip. I've got 250 milliliters, and I've got 50 milligrams of drug in that. And my question is going to be, how many drops per minute do I infuse into my patient? So first things first, let me mark out milliliters. Let me mark out all the units I can. So that's milliliters gone, top and bottom. Again, I've got that micrograms milligram issue. So I'm going to mark out this milligrams. I'm going to multiply 50 times 1,000. That's going to give me 50,000 micrograms. Now I can mark out micrograms on the bottom and to the top. I've got drops over minute on the left side of the equation. That isn't in. And I've got drops over minutes on the right side of the equation. So now I can do math. Again, marking out the zeros I can. 0 on the top, 0 on the bottom, 0 on the top, 0 on the bottom, 0 on the top, 0 on the bottom. Again, very important to make sure that this is 1 per 1. So now I'm going to, now that my units balance out, I've marked out all the zeros I can. Now let's do the rest of the math. So we've got, I like to do it a little bit differently. I've got 2 times 25. That's going to give me 50. And 50 times 6 is going to be 300 divided by 50. Now again, I can do the zero thing. I'm going to mark out a 0 on the top and bottom. And I know 5 goes into 30 6 times. So 20 micrograms per minute delivered to my patient is going to be 6 drops per minute. Now, how many seconds between drops is that? Again, I've got 60 seconds in a minute, and I got to give 6 drops a minute. So that's going to be 1 drop every 10 seconds in this case. So I want to see a drop. I'm going to count to 10, and I should see another drop. All right. A little bit difficult to adjust in the back of a moving ambulance without an IV infusion pump, but this is the way you've got to do it, literally. You initiate the drop, and you've got to roll the roller clamp up and down until you can get 1 drop every 10 seconds. That should give you your 6 drops a minute. Okay. Give you a moment there to finish copying that off. And it's gone. So back over to our presentation. So the next thing we're going to do is dopamine. So we're administering dopamine infusion, 5 micrograms per kilogram per minute. Now notice, this is a weight-based drug, 5 mics per kilo per minute to a 165-pound patient. So we got the patient's weight in there. We've got to do our conversion into kilos. Our drug concentration is 800 milligrams and 500 mLs. You're using a 60 drop per milliliter infusion set. How many drops per minute? So going back over to the whiteboard. All right. So first thing, let's figure out that patient really quickly. 2.2 into 165. Move the decimal. 22 will go into 16, I'll say 7 times. No, I'm sorry, yeah. 7 times 2 is 14. Carry 1, that's 15. 5 minus 4 is 1, 6 minus 5 is 1, 0, 22 will go into 110, 75 times, okay? So our patient's gonna weigh 75 kilos. So let's just put that in our little memory banks, all right? Let's do our drug calculation. So we've got 5 micrograms per kilogram per minute, okay? And we've got our drip set, 60 drops per milliliter. And we've got our concentration. Remember, we want to invert that. So we've got 500 mLs over 800 milligrams. And finally, we've got that 75 kilogram patient to add on there because this is a weight-based drug. I'm just going to write it over 1 just to keep it fractional. It does not change the value of my patient's weight. Again, our ultimate answer is how many drops per minute. Now this is dopamine. This is probably going to be the most involved drug calculation you've got to get. So you can get this one worked out, you're going to be good to go. Let's start by marking out units. Milliliters top, milliliters bottom. Kilograms top, kilograms bottom. Again, I've got micrograms over minutes. I have drops and I've got milligrams. So again, let's make those milligrams go away. 800 milligrams is the same thing as 800,000, 1, 2, micrograms. Okay, so micrograms are gone, top and bottom. I can take out a few zeros. So 0 top, again, point being drops over minutes on the left, drops over minutes on the right. So making the zeros go away. 1 on the top, 1 on the bottom, 1 on the top, 1 on the bottom, 1 on the top, 1 on the bottom. So got some pretty large numbers here. When I multiply this out, 5 times 6 times 5 times 75, I'm going to get a number that should be 11,250. And I'm going to divide that by 800. Again, I can mark the 0 off on the top and the bottoms. Now I've got 1125 divided by 80, and that should give me an uneven number. I think it's 14.06 drops per minute. But again, we're going to round that down to 14 drops a minute. So once I get this figured out, I've got to determine how many drops between seconds. So let me give me a little space to work over here. And if I say 60 divided by 14, that is going to give me a drop. Roughly, it says about every 4.2 seconds, but we're going to say 1 drop about every 4 seconds. So it's literally drop 1001, 1002, 1003, 1004, drop is the way you're going to try to get your IV to run for this particular patient. Give you another moment there to copy down any information you need. And we're going to clear this out and go back over to our next one. All right, so this time we're going to be administering lidocaine, 2 milligrams per minute. Again, this is not weight-based. We've got a concentration 2 grams in 500 mLs using a 60 drop set. Two milligrams per minute. And we've got our 60 drop per milliliter set. Again, make sure you write that as 60 drops per milliliter, not per minute. Now you get tired of hearing me say that, but very important. A lot of people make that mistake often. We've got our concentration we're going to flip, 500 milliliters with 2 grams in it. And I need to know how many drops per minute. Like I said, if you can figure out the dopamine in the previous one, this should be a breeze for you. So first things first, let's mark out the units we can mark out. Milliliters gone, top and bottom. Milligrams, minutes, drops and grams, that's no good. I got to make it match to my drops per minute on the right side of my equation. So again, just like 1,000 micrograms equals 1 milligram, we know that 1,000 milligrams equals 1 gram. So I'm going to mark this gram out here. I'm going to make this 2,000 milligrams. So now I can mark out milligrams top and bottom. I'm left with drops over minutes on the left. I got drops over minutes on the right. So now I'm ready to do math. Again, lots of zeros to take away. 0 on the top, bottom, top, bottom, top, bottom. Pretty easy math to do right here. Looks like something we did a few minutes ago. 2 times 6 is 12, times 5 is going to be 60, very close to what we did earlier, divided by 2, which is going to give us 30 drops per minute of lidocaine to infuse into our patient. Again, 60 seconds in a minute, 30 drops per minute equals 1 drop every 2 seconds going into our patient. Okay, and I've got one last problem to show you. We're going to end this with a little Levophed, also known as norepinephrine. So we're administering Levophed, norepi, 4 micrograms per minute with a drug concentration of 4 milligrams and 250 mLs. So this one says 4 milligrams per 4 milliliters. I think I got something wrong. Apparently I got the wrong concentration on here. 4 milligrams per ml. I think this is a vial that we've mixed. Okay, so we're going to mix this. The little label I've got here is from a vial. It's not from an actual bag of a solution. So we're going to say that we've got 400 milligrams mixed in 250 mLs. You're going to be using a 60 drop set. Remember, you may get drug in a vial and you may have to mix your own drug. It's usually cheaper that way. So depending on your agency, they may be requiring you to mix your own medication. All right. So our orders were 4 micrograms per minute. And we have a 60 drop per milliliter set, as we've had all along, per milliliter. And our drug concentration was a 250 bag that we mixed up, and it's got 4 milligrams of drug in it. And we've got to determine how many drops per minute. Okay, so milliliters gone, top and bottom. We've got that microgram milligram issue, so we're going to mark out our milligrams. We're going to change this to 4,000 micrograms. Now we can mark out our micrograms top and bottom. We've got drops over minutes on the left side of the equation, drops over minutes on the right side of the equation. Let's do some math. Take out a 0 top, 0 bottom, 0 top, 0 bottom. So the way I would look at this would be 4 times 25 is 100, times 6 is going to be 600, divided by 40. And again, I'm going to take those extra zeros off. So now I've got 4 goes into 16. I'm sorry, 4 goes into 60 15 times. So our answer is going to be 15 drops a minute. Now I need to know I've got 60 seconds in a minute, 15 drops per minute. I'm going to do 1 drop every 4 seconds to infuse into my patient. Okay. Beyond this, give you just a second to record that down. I'm starting to run out of time here. And I'm going to go back over to my presentation. Beyond this, I'm going to have Jeremy and Billy or whoever uploads this into Blackboard for you. I've got 4 more similar but different calculations for you to be able to work on your own time. Okay, try to get this knocked out in the next week or 2. There's my phone number and my email address. Please reach out to me with any questions or concerns you have. Hope this has been beneficial. You guys, please stay safe out there. I appreciate your service. Take care, and we will see you really soon. You know what? Let's come back to it because I don't think I was sharing that with you. So again, if I didn't have that up there, you've got 5 more drug calculations. And there's my contact information. So again, take care, guys.